Welcome to Therapy Thursdays on Louisiana Living. We are physical therapy and balance centers of Ruston, Jonesboro, Louisiana, and ElDorado, Arkansas. I'm Angela Yarborough, and this is Dr. Jerry Yarborough.
Hey.
And today we're going to talk about whiplash. And I read that over 3 million people are affected every year. That is a lot.
That is a lot. 3 million people, and of that 3 million, about 150,000 actually become permanently disabled from it.
Wow.
So that's a lot. So whiplash, just to kind of explain real quick what it is, it's normally caused from a motor vehicle accident. Some other things can cause it, but that's the most common cause. Being hit from behind more commonly, or even from the side. And what happens is when you're hit from the behind, your head is thrown back like that and then thrown forward like that real quick. And it's also known as the acceleration-deceleration injury. And so many things can happen whenever your head gets whipped around like that. And also, if you think, you're not expecting that to happen, so you may be turned talking to someone, or looking down or looking another way. So it's not like you're in perfect alignment, just waiting for your neck to be thrown around like that. So many times, because of the position, it really complicates things. So step back just a minute and talk about the anatomy of the neck. So, our spine is made up of a bunch of bones called vertebrae stacked on top of each other. And the ones in the neck are called cervical vertebrae. There's 7 of them. And they stack on top of each other. And in between each one of those is a disc. That's the cushion between those 2 vertebrae. And where those 2 vertebrae come together on the sides, they're connected by what's called a facet joint. And it makes a neural foramina, or a hole for the nerves coming off the spinal cord to exit out, which are going to innervate the muscles in your neck and down your arms and even in your upper back. So all of that can be compromised, and so many times, you can end up having neck pain. Of course, 90% of the people will have neck pain, but you could also have jaw pain. You could have headaches, you could have dizziness, you can have arm pain or cervical radiculopathy, which is pain going down your arm from the nerves that are coming from your neck. And very common also is even back pain. So it's very important that you are assessed after an injury. You can actually have much more pain 24 to 72 hours after an impact. And it definitely needs to be addressed then, because remember, acute pain that happens right then, is much easier to overcome than chronic pain, okay? If you don't deal with that acute pain, it becomes chronic pain. Any pain that lasts over 30 days is chronic pain. And then our body, the memory in our cells starts to think this pain is normal, and it's not, and movements that have no reason to hurt. So it can be very debilitating. So make sure with any injury that you address and seek the proper medical attention. What we're talking about is now some exercises that you can do to help overcome the symptoms that you're having from that whiplash injury. Way back, the medical community thought, rest. You have to rest, have to not move and all that. Well, that's not necessarily the case now. You do want to rest. You don't want to do any lifting. You don't want to do anything strenuous. And you may even want to wear a soft collar neck brace, just to let your muscles relax from time to time. Don't wear it all the time, just from time to time. And you want to do some range of motion exercises just to keep the muscles stretched out and moving, improve that circulation. So we're going to do cervical rotation, right to left. And Skylar is our subject today. Skylar is one of our student interns here from Louisiana Tech Kinesiology program. So we're so excited to have her. And so you got cervical rotation and then cervical side bending. So you're gonna take your ear toward your shoulder, okay, and just nice and easy movements. I don't want you to do a lot of stretching. I just want you to maintain movement. And then bring your chin to your chest. There you go, and then looking up at the ceiling. All right, those are good cervical range of motion exercises. You wanna keep things moving. That'll help relax those muscles. Then you're gonna do shoulder rolls. You can do them forward, and then you can do them backward. All right, and I want you to do all of these about 10 times, about 4 or 5 times, 6 times throughout the day. As you're hurting, just try to keep things moving, okay? All right, and then scapular retraction, where you're pulling your scapula together, okay? Make sure you're maintaining good, proper posture. All right, and the last thing I want you to do is a chin tuck. Bring your chin straight back, okay? Just like that, just kind of making a double chin, all right? Hold that for a few seconds and that's good. All right, guys, if you do these will really help overcome the acute symptoms of whiplash. And if you need further assistance, please come see us or any local physical therapist. Thank you, and we'll see you next week.